Hi, everyone. My name is Namrata. I'm a rising senior at Jesuit High School in Portland, Oregon. And today I'm going to talk a little bit about the potential of a blood test for use in cancer diagnostics and for improving cancer prognoses. So a little bit about me. I'm super interested in medicine as a whole, particularly in healthcare disparities, health policy, and cancer. I think a lot of my interest in these areas came from attending the Global Health Leaders Conference last year, and that was really my first exposure to global health. I'm also interested in the humanities, especially in history and political science. At school, I am the co-founder and co-president of Jesuit High School's HOSA chapter, and I'm the captain of my school's Science Olympiad. I participate in National History Day and History Bowl to further my interest in history. So let's get right into it. According to the American Cancer Society, cancer is actually the second most common cause of death in the United States, following only heart disease. And although the risk of dying from the disease has decreased over the past couple of decades, the number of cases diagnosed and the deaths are still more than significant. By the end of 2022, the ACS predicts that 1.9 million cancer cases will be diagnosed, and more than 609,000 people will die of cancer this year. This issue is especially concerned with global health due to the of accessibility depending on a variety of factors, such as your socioeconomic status, your race, and the country you live in, as well as others. Many cancer cases are unfortunately diagnosed late or when the cancer has advanced into a metastatic state. And this means that it has started growing at a site other than its primary location. For example, lung cancer originates in the lungs, but during metastasis, you see tumors associated with lung cancer that grow in another location of the body, like the brain or in the bones. And through a process known as intravasation, cancer cells utilize the bloodstream and the lymphatic system to move through the body and access other organs. This makes treatment exponentially more difficult, and cancer diagnosed at late stages of metastasis have a much poorer prognosis and a lower survival rate. So on my screen, you can see some of the very standard procedures that patients in the United States and other first world countries undergo when cancer is suspected as a possibility in a patient. These include endoscopy, tissue biopsy, colonoscopy, and advanced imaging techniques like MRIs, X-rays, among other things, as well as genetic testing. Each has its own unique benefits, and each is able to diagnose cancer in its own way, but there are also some inherent disadvantages. For example, endoscopies and colonoscopies are invasive procedures, and they require the patient to go under anesthesia. Tissue biopsies can puncture nearby organs or tissues, leading to infection, hemorrhaging, excessive bleeding. Imaging procedures are some of the most expensive diagnostic tests available. For a lot of cancers that are less common or are even classified as rare, there is often no standard diagnostic exam because they are just that infrequent and don't occur all that often. But all of these procedures have one pressing issue in common. They are extremely difficult or even impossible to access in developing or third world countries. So how about blood tests? Several leading research facilities and hospitals have looked into the possibility of using a blood test to diagnose cancers. In fact, many tests have been developed to date, but a lot of these are not yet available for use in a hospital. Today, we'll be discussing two such tests called CancerSeek and the Cell Search Circulating Tumor Cell Test. CancerSeek, the first test, was actually developed by researchers coincidentally at the Johns Hopkins University School of Medicine, and it screens for proteins indicative of cancer, and it screens a blood sample to figure out if there are proteins that can indicate the presence of cancer in the body. The Cell Search Circulating Tumor Test by Johnson & Johnson, which also developed a COVID vaccine, it scans for CTCs, which stand for circulating tumor cells, and it's currently FDA approved, but it's being used in vitro for the time being. Circulating tumor cells break away from the primary tumor and they enter the circulatory and lymphatic system, so the blood and the lymph. And that's how metastasis actually occurs. You have these cells that break away from the tumor and move through the body by using the blood and the lymph. It's possible to detect these cells in the blood, and that's the goal of the Cell Search test. So there are three notable benefits of such a test being put into practice. First of all, this would definitely be more affordable than the more traditional screening methods, being that it's a blood test. Imaging procedures can cost anywhere from $500 to $1,000, and in many countries, for many people, this is unrealistic for a single diagnostic test. Any blood test, even if it screens for cancer, would likely be more affordable than this. Due to the cost of an MRI or an X-ray or any other standard diagnostic exam, many patients who experience symptoms like pain in a location of the body are less likely to seek medical treatment and care because they aren't able to pay for it. And secondly, it's non-invasive. It doesn't require anesthesia, and because patients undergoing the procedure would not have to take time off to recover from it. And in many communities where workers receive a paycheck on a day-to-day basis, time off from work to travel or recover for a procedure can make a huge difference for them. Being non-invasive, you are significantly less likely to puncture a vital organ or cause infection as long as the test is performed with a clean needle by a professional. And lastly, it's accessible, meaning patients would not have to travel long hours to receive the test. This gets back to the cost a little bit, and traveling to another country to receive a test can put a large cost burden on the family, in addition to the fact that they already have to pay for an expensive diagnostic test in a different country. A blood test would be available almost anywhere and doesn't require advanced medical technology or patients to travel far from their home country to receive one. They're convenient because they can be done at a rural hospital, but be sent to a different facility for processing and analysis. On another note, many countries with universal health coverage only offer these tests to patients who are considered high risk, and they only offer government reimbursement to these high risk categories. So making the test more affordable would expand the range of groups that the government could cover procedures for, and more people would be able to receive a test if they suspect cancer because of a symptom or for any other reason. Here are some of these sources all of these sources that I used in the creation of my presentation. These include sources from the Stanford University School of Medicine, the National Cancer Institute, the Johns Hopkins Medicine Newsroom, the Journal of Oncology, and others. I would first and foremost like to thank you, the audience, for taking the time to learn about cancer diagnostics, as well as the pressing public health issues that are being presented by all the other amazing students today. I would like to shout out my family for supporting me in everything I've done and continue to do. Thank you to Dr. Lara Shamia of Jesuit High School for reviewing the content that you saw today. Thank you to the Global Health Leaders Conference and Johns Hopkins University for providing this platform for students like me who are interested in learning about global health and how it is very important in the world today. If you have any questions about what I discussed today or any of the content that I went over, my email is shown on slides. I would love to hear from you, so please feel free to reach out if you have any questions or comments. And once again, thank you all for listening, and I hope you all have a wonderful day.